Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zach Caseberg, your host, coach, guide along the path of passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know more about the CDR exam. If that sounds like you, then hey, you're in the right place. If you listened to last week's show or if you're listening live, then you know that we just held a YouTube live on the RD exam YouTube channel. It was wildly successful. We had several students join us as we reviewed the fat and water soluble vitamins. Again, if you haven't, go sub to that channel. My big goal is that you can watch the pod there if you like. Some people prefer to watch stuff on YouTube, but really my big thing is it easily gives access for students to view free content and learn with me. I'd like to do more of these in the future. As of right now, we're about to head into the holiday season, so I won't be doing much this week, but stay tuned for an announcement of the next YouTube Live if you'd like to join that in the future. Talking about vitamins really triggered my brain this week, folks. Got me to thinking about the GI system. Now, the GI system can comprise so many nutritional issues just based on the fact that that's where you're absorbing, breaking down, processing so many of the micro and macronutrients of your body. It's kind of crazy to think about that we talk so much about biochem and fuel for the body, but ultimately, if you don't have a proper way to absorb these things or break them down, you're not going anywhere, right? So I thought this is a good time to maybe talk through some of these GI disorders a little bit, go through the MNT, and give you some background on all of them. I'm going to try and squeeze in a one-parter with this, but I think I may have to do a follow-up episode to go through some more of like the bariatric disorders, surgical things that can occur with the GI system. But when it comes to the GI system, of course, we're just starting with the basics of it and where things happen and where things are being absorbed. So we got to start at the top, and that's in the stomach. For each of these disease states, I like to take the approach of starting with the disease name and its description. We want to know the brief description of the disease and then break down into the etiology, the causes, the signs, symptoms, medications, and labs. And then we'll finally go through the nutrition therapy that's necessary to know for exam day. If I don't mention a medication or a lab for some of these, it's likely because there might not be anything present. Might not be a lab for most of these that we're going to talk about. So if I don't mention anything, you're not missing it. I just want to give you what's necessary for your exam day there. GERD is also known as gastroesophageal reflux disease, and it's a dysfunction of the lower esophageal sphincter, or it can be caused by excessive stomach pressure or acid that causes these gastric contents to come up through your esophagus, which is no good. For some people, the etiology of GERD could be obesity, where if we have an excessive amount of body fat, it's pressing and putting pressure on kind of the gastric area, and that's making those contents go up. It's kind of like you squeeze the middle of a balloon and you notice how it kind of squeezes up or down. That's kind of what's happening here. A lot of the times, we see an issue with the lower esophageal sphincter. Now, that lower esophageal sphincter, or LES, is supposed to open when food contents need to pass into the stomach and then close, right? But what happens is when there's a dysfunction of this sphincter, it's then those stomach contents and the acid is refluxing past it. And that's how it's ending up into the esophagus there, which is not a very pleasant feeling. Other etiologies for GERD could be things like medications, lying down after eating large meals, smoking, nicotine use, hormonal imbalances. These could all be things that contribute to GERD. Signs and symptoms? Well, with GERD, what we're seeing is if the classic things you might have heard, we can have some dysphagia or trouble swallowing with the patient. They'll have that heartburn feeling in their chest. They may have a burning sensation in their chest. Their lower esophagus may feel irritated, and they might have some excessive salivation or belching. For medications, the medications that are used for GERD are mostly used to help to treat the amount of acid. One first line of defense is that like an antacid. Antacids are things that, well, reduce acid. Tums is a great example of an antacid that can help to treat GERD. But if that doesn't do it, you might need to resort to some other stronger medications, like proton pump inhibitors and histamine blocking agents. These are a class of medications that help to decrease the amount of acid that's produced in the stomach, and that's going to help those symptoms. Another thing that can help is prokinetic agents. And prokinetic agents, prokinesis or pro movement. So, prokinetic agents help to move those contents through the stomach a little faster. So, maybe they don't reflux a little bit here. Now, tell me, RD to be, what nutrition therapy do you recommend for me when I have GERD, which has happened for times? Well, you need to tell me what types of things to avoid, right? So we need to avoid those offending foods of GERD, which would include things like dairy, eggs, fried foods, especially pepper or peppermint, alcohol, caffeine, coffee, carbonation. These are all things that can make GERD much worse. So, nutrition therapy is to avoid those things. Now, for the lifestyle, we would recommend people definitely lose weight if it's indicated. A good thing to do is to walk after meals so it keeps you nice and upright so that those contents will not reflux up. And another thing we would just want to mention too is small, frequent meals. That'll definitely help. But you may want to consider a little bit of some micronutrients that could be impacted. For people that take long term medications for GERD, sometimes that may impact your B12 and iron status a little bit. So you may have to supplement those because really iron loves an acidic environment. So if you reduce the acid, it's going to affect the iron. And then any medications that can impact the stomach may impact intrinsic factor. So that can then in turn impact B12. So again, nutrition therapy would be to avoid those foods we talked about and get those medications. Now you are all set on GERD for exam day RD to be. Now, the next one I want to go through is when you might not be familiar with, it's a little one called EEO or eosinophilic esophagitis. That's my best guess there. Now, esophagitis being the big thing I want you to focus on, which is inflammation of the esophagus. The etiology to this condition is due to actually an overreaction of the immune system. And this immune system can really be exacerbated by common food allergens for some people. People can develop this due to genetics, environment. I'm pretty sure it's not as well understood as many other GI disorders. With esophagitis, you would expect signs and symptoms to be irritation of that esophagus, difficulty swallowing, heartburn, and food impaction. If you have too much inflammation in this area, the food might get impacted in that area, which fits really well with dysphagia for me. For medications that were noted, proton pump inhibitors have been used to reduce the amount of acid. You can use inflammation, and steroids have been known to help EEO as well. And for nutrition therapy, we recommend an elimination diet, especially with the common food allergens that could exacerbate EEO. You would want to do an elimination diet where you remove all those foods or allergens and then slowly introduce them to find out what the offending food is. And then inevitably, you're going to avoid that food. So that is your little nutrition therapy for EEO. Dysphagia is your next one. And it's really, dysphagia is kind of like a sign and symptom, but it is a condition, right? So, dysphagia has the description of just difficulty swallowing in general. The etiology just could be, you could write a book on it, but the most common ones that I've encountered is head and neck cancers, neurological issues, having a stroke, having a CVA, can all cause you to have dysphagia or impact your ability to swallow. Now, for signs and symptoms for dysphagia, what you can see is people that will just have the difficulty swallowing or painful swallowing. They may have a coughing, a choking sensation, and they can even aspirate the food or liquid into their lungs as a result of dysphagia. There is medications that can help to treat this a little bit. One thing is if the dysphagia is causing actual pain, commonly a physician may recommend an NSAID or an opioid to help relieve that pain, especially during swallowing after radiation therapy. They'll use opioids to treat pain and make swallowing less painful. I remember Magic mouthwash was this really common medication. It's a lidocaine substance that people can gurgle in their throat, and that helps to numb it up a little bit. I have no notable labs for dysphagia, but I do have nutrition therapy. The goal for nutrition therapy would be to avoid weight loss and avoid any inadequate intake. We definitely want this patient to be evaluated by a speech therapist for swallowing safety, and hopefully they can also put them somewhere on the IDSI guidelines, which remember are those international dysphagia guidelines that are being used in many hospital systems. They can help tell us what is safe for this patient to swallow in terms of solids or their liquids in this case. So a swallow eval would be a great place to start. For nutrition therapy, you're going to recommend the patient consume foods that are easy to swallow. Things like liquids, oral nutrition supplements. We would want to use moist foods, soft foods to definitely help them out there. Avoid any hot or boiling beverages, right? Because that's going to make it maybe a little worse. Hopefully, if we're able to meet their needs orally, we're all good. But if you're not able to meet this patient's needs orally, you're going to have to consider some nutrition support, preferably that of enteral nutrition, so that we can continue using this patient's GI tract. We're going to move into the stomach a little more here. And we're going to go through gastritis, which is inflammation of the stomach or the gastric mucosal layer that protects your stomach from being burned. Remember, you have that hydrochloric acid, it's very acidic and really mess stuff up. And so, this gastritis can further make that kind of worse a little bit. Now, the etiology of gastritis is it can be caused by a bacterial, a fungal infection, or a parasitic infection can cause it. Alcohol use can be a cause, and excessive amounts can cause that issue. And then some people who take excessive amounts of ibuprofen can also end up having gastritis or other NSAIDs. Signs and symptoms would be kind of that cough. You could have coughing up of blood because if that inflammation leads to bleeding, you could cough up blood, for instance, could be one thing that could occur. And you could also maybe have some just internal bleeding, stomach pain after eating too. For medications, those acid inhibitors would be pretty helpful for this patient because the acid is going to make that gastritis worse. So, using those antacid type of medications would be helpful. Steroids are good to treat gastritis, and antibiotics are commonly used if there's a bacterial cause to gastritis. For nutrition therapy, just think what we should work on avoiding for someone who's having issues with their stomach. So that'd be stuff like spicy foods, acidic foods, alcohol, coffee. Those would be all things we would want to avoid in general when we have a gastric issue, right? I would also say continuing evaluating that B12 and iron status, just if that gastric area is not acting correctly, chances are you're going to have some issues with intrinsic factor or iron and not being able to absorb and break those things down correctly. Now, that's all you need for gastritis. Peptic ulcer disease. These are ulcers that develop in the gastric or the duodenal mucosal area, and they infiltrate this submucosal layer, meaning they're deep. It's not a fun feeling having an ulcer, and there's multiple etiologies. Use of NSAIDs, like that of ibuprofen, can cause peptic ulcer disease. Excessive acid secretion can cause peptic ulcer disease. Alcohol, smoking, GERD, these can all lead to peptic ulcer disease. And a really common one could be H. pylori bacteria, which is an antibiotic resistant bacteria and can cause peptic ulcers in people. Now, the signs and symptoms if you have an ulcer would be you're going to have pain in that epigastric area. It's not going to feel good. Likely, you can have blood in your stool or blood in your vomit because if that ulcer is bleeding, the blood's going to go somewhere. For medications, we would want to decrease the symptoms of how inflamed that this ulcer is getting. So that would include using some of those antacid type of medications so that the acid just chills out and doesn't make that ulcer any worse. And I do want to make note of some labs. If you are having bleeding, then you may see some labs that could point to that bleeding. And that would be things like a low hemoglobin, a low hematocrit. Those would be reasons that could indicate that a patient is bleeding too much when those go too low. So if you're losing blood, you're losing hematocrit, you're losing hemoglobin, and you could see low levels of that too, kind of going through there. Now, for the nutrition therapy, your goal should be to support the medical treatment and improve this patient's nutrition status. We would definitely want to avoid some of the foods that are going to further make that ulcer a little more painful. So, avoiding things like alcohol, coffee, whole fat or high fat foods, like fried items, avoiding things like pepper or spicy foods. Those are going to all just to help make that a little easier on that ulcer. Okay. That is it and all you need to know for peptic ulcer disease. Gastroparesis is a very important term that I want you to know. If you were my student being tutored by me, I would sit you down and say, what's gastroparesis? Figure it out. Gastroparesis, think gastro, stomach. Paresis, like a little bit like paralysis, is what we're seeing there. Gastroparesis just means delayed gastric emptying or slowed gastric emptying. This can be an etiology cause of dysfunction of the hormonal system, the nervous system, the muscular system that normally would help those food contents to move out of the stomach. We could see different things like medications could cause it, and even different foods that we eat in different macronutrient content can lead to this kind of gastroparesis feeling that people are seeing. I've also seen a lot of patients with diabetes who have gastroparesis as well. When it comes to gastroparesis, the signs and symptoms would be excessive fullness. It's like you just ate a big Thanksgiving meal, but you didn't eat that much. So you'd be bloated, you'd be full, you'd have early satiety. It could lead to vomiting. If that food sits there long enough, we know that can make you have an upset stomach. So inevitably, it's got to go somewhere. Some vomiting is something that can happen. For medications for this, we need to, well, what do you think we should do? We got to speed things up here, folks, because if everything's emptying so slow, we need to go the other way. So that's when we would employ those prokinetic agents or pro-motility agents, things that help to move things along. Reglan was a really common one that I saw in the cancer setting that would help people with gastroparesis. Antiemetics or anti nausea medications are also very helpful just to get them through that uncomfortable part of after a meal. And for nutrition therapy, the goal would be to meet their needs and reduce their symptoms as much as we can. So, kcals, protein, I think those are going to be very standard for what their needs are. We can supplement things like iron, B12, vitamin D if they are in low levels of those. And really, with gastroparesis, the big thing you're going to see in a practice, well, in the questions, are going to be the types of macronutrients that you eat in a meal. What we need to avoid for this is any of those slow digesting foods. Things that are slow digesting would be really high protein, high fat items, and high fiber foods. These are all so slow digesting that we wouldn't want to do that too much, especially fats and fiber. They're so slow digesting that for gastroparesis, we don't want them eating excessive amounts of those high foods like that. That would include things like raw fruits and vegetables, right? Let's not do raw fruits and vegetables because that's going to make their gastroparesis slower and worse. So that's going to tie you up for gastroparesis there. Now, the next condition we're going to talk about is just plain old diarrhea. Diarrhea is just increased frequency or increased water content in the stool. There's so many etiologies for diarrhea. There's bacterial and viral infections, medications like use of laxatives, and of course, GI disorders and diseases all cause diarrhea. Even people who have malabsorption are going to lead to having diarrhea too. Signs and symptoms of diarrhea would be electrolyte imbalances. You're losing a lot of electrolytes through stool because it's not really absorbing those in the colon. Dehydration is quite common in diarrhea. We see it all the time with some of our older patients. Stomach cramping, stomach pain. Even sometimes we'll see fat content in the diarrhea. So when there's fat content because of malabsorption, we call that steatorrhea, where there's these fatty streaks in the stool. So these are all different types of signs and symptoms that you could see with this. For a medication to treat diarrhea, you're looking for medications that slow stuff down, slow it down. So, antidiarrheal agents like that of Imodium is very helpful to slow that GI tract and bring it down. If someone is excessively dehydrated, IV fluids are usually recommended to help balance out that dehydration, and antibiotics can also be used when there's a bacterial cause to the diarrhea, too. For labs, we can see low levels of electrolytes such as hypokalemia, hyponatremia as possible causes there. You may even see a low pH caused by metabolic acidosis because if bicarb is just leaving the body through diarrhea, we're not reabsorbing it, then we could lead to low levels of base and end up in metabolic acidosis too. Another thing that we'll talk about here is the nutrition therapy for diarrhea. The overall goal, again, is to meet in those needs, reduce symptoms. We don't have any notable changes in kcal or protein needs that need to take place. For fluids, we want to restore their normal fluid status, including things like electrolyte solutions to help out with restoring that electrolyte balance too. We do have a few things we should avoid if we're having diarrhea, though, and a few things we would recommend. We want to avoid things like high sugar, high fiber foods, coffee. We want to avoid those things, any stimulants, right? Do want to talk about why this is, though. Remember osmosis. Osmosis is whenever we have a time where water will shift from a low solute concentration to a high solute concentration. And I want you to imagine this as being the same in your GI tract. If I myself take a big bunch of sugar, that sugar is sitting in my GI tract, and then the water naturally wants to go towards it because it wants to go through osmosis. But this is further exacerbating people's diarrhea because those sugary substances are taking that water and it's all going out so quickly. And then for fiber foods, especially things that are sources of insoluble fiber, it's really going to speed things up a lot of the time. So we want to avoid those high fiber, especially high insoluble fiber foods that could make things worse. For things we want to encourage, we can include some water soluble fiber, and that would be things like sources from bananas, from oats, banana flakes, applesauce. Those would be all good things that are a good source of soluble fiber. They can help absorb a little bit of that water there. Um, and then another thing that we would probably recommend would be things like probiotics, prebiotics, anything that can help to restore that normal health of the GI tract would be all really good things to include there. But now we got to swing to the other side, and that's constipation here. That's the opposite of diarrhea, which is decreased frequency, hard or strained bowel movements. What causes it could be a multitude of things. Pelvic floor dysfunction, for instance, after women give birth, they commonly will experience constipation as a result. Opioids are a common thing that cause constipation. And then people who take antidiarrheals like Imodium will end up swinging to the other side towards constipation. And then, of course, there's other conditions like irritable bowel syndrome, a GI tumor, neurological disorders. These can all cause constipation. And in some of our elderly patients, we certainly see very low fiber diets. And so sometimes that can cause constipation too. The signs and symptoms are pretty obvious. You're going to have hard stool, decreased stool frequency, continued use of enemas or laxatives just to have a bowel movement. These would be all reasons that would lead to constipation. And for medications, what doctors are going to recommend would probably be a stool softener and bulking agents, something to help you with just passing the stool more traditionally. For nutrition therapy to treat constipation, again, we're going to meet their needs, reduce their symptoms. No notable differences in kcals or protein just because they have to poop. So, we do want to keep the fluid intake nice and high. We know fluid intake is going to help to move that stool faster, hydrate it, and make it much softer to pass. And then, as far as just some other things to include, adding fiber, probiotics, and prebiotics are all going to help to restore that normal GI tract function and normal frequency. So we'd want to throw those in just to help them out. Okay, RD to B, how are you doing? We got about 4 or 5 more diseases to run through, so stick with me. Celiac disease is an autoimmune disease caused by an immunological reaction to gluten, which is a protein that we know is present in wheat. The etiology of this is typically genetic. There is a T cell mediated inflammatory response that can cause celiac disease, and there may be some environmental circumstances that could cause this during the infancy period. So that could lead to celiac disease too. Mostly, I think we're looking at genetics. For signs and symptoms, we would see things like diarrhea, abdominal pain, cramping, bone, joint pain. This typically will happen right after someone has been glutened, whether they intentionally ate gluten or unintentionally ate gluten. I don't have any discernible medications or labs to make note of here, but we do need to talk through nutrition therapy. The main nutrition therapy would be to educate a patient on a gluten free diet. Gluten free diet is really all they can do to treat this, and teaching them about how to avoid cross contact. Make sure you know what cross contact is. I've talked about that before. So we need to avoid any wheat containing ingredients. Let's go through our list. That would be wheat, rye, barley, malt, durum, semolina, couscous, kamut, triticale, farro, and any oat products that are not labeled as gluten free. Oats themselves do not contain gluten. It's just that they're typically processed in an environment where gluten is present. So, if I had a practice question about celiac disease and I had 4 answers, 3 of them are wheat containing ingredients, and then the fourth one is gluten, sorry, let me back that up. Let's say I have a practice question about celiac disease, 4 options, and it's wheat, rye, barley, and oats. Well, the oats would be the thing safe for them to eat if all 3 of those other ones all contain wheat. And I hope that makes sense as far as how that goes. So, oats don't have gluten, just commonly processed with gluten. Irritable bowel disease, or IBS, is a condition that leads to abdominal pain, and the diagnostic criteria for it is that there is bowel habit changes at least 1 day per week over a 1 month period. The etiology of IBS is not fully known or understood. It can be food sensitivities or intolerances, an altered microbial environment, altered motility, an altered nervous system, elevated inflammatory response to gastroenteritis can cause IBS, and small intestinal bacterial overgrowth, or SIBO, could also be a cause of it too. The signs and symptoms of IBS are abdominal pain, diarrhea, constipation, gas or flatulence, and even gastric reflux can occur. For a medication, we're treating a lot of the symptoms that occur. So, antidiarrheals or anti constipation agents or stool softeners, would be helpful if that's indicated. Antispasmodics, which can help treat the stomach pain, antidepressants, and peppermint oil was also something that was noted for IBS that can be used as a medication. The nutrition therapy for IBS is a low FODMAP diet. Remember, those FODMAPs are those carbohydrates that are difficult to digest with someone with IBS. So, FODMAP stands for fermentable oligodisaccharides, monosaccharides, and polyols. So, we would want to give them a nice education about a low FODMAP diet. But don't get mixed up IBS with IBD, which is inflammatory bowel disease, and this is our next one. IBD comprises 2 different diseases, 2 disorders. That is ulcerative colitis and Crohn's disease. IBD is characterized as an autoimmune disorder causing chronic inflammation of the GI tract. The etiology is unknown, and each of these 2 disorders has some different signs and symptoms. So, ulcerative colitis is only really occurring in the colon. So, what we see is abdominal pain and bloody diarrhea. Since it's occurring in the colon, you can see how bloody diarrhea could occur. And people with IBD have urgency to use the bathroom all the time, right? For Crohn's, we see abdominal pain and just standard diarrhea, and as well as that same urgency. Common medications would be steroids, antibiotics to help to treat that IBD disorder there. And then in labs, one thing that was noted in the text is you may see an elevated C reactive protein in the labs. Remember, C reactive protein, that is one of those positive acute phase reactants. It's a lot of words to say. It's an inflammatory lab. It goes up when we're in periods of inflammation. So you may see a high CRP for one of these patients. For nutrition therapy, high kcal and high protein is recommended for the patient just to make sure we're meeting their needs, avoiding them from losing weight. That's what we really need to focus on here. And our next one, and I believe our final one, is diverticulitis or diverticulosis. Diverticulosis is this presence in the abdominal area of these pouches on the surface of the small intestine. Okay, these diverticula. And then diverticulitis is inflammation of those diverticula. Okay. So we're going to go through a little bit of what causes this. People end up in diverticulitis for multitude of reasons. Obesity is a really common cause of it. People who consume a low fiber diet can lead to diverticulitis. And the signs and symptoms would be that's when they're having diverticulitis is they're going to have a fever, abdominal pain, some GI bleeding because of those diverticular bleeding. The blood's got to go somewhere. For medications, probiotics are used to help maintain that normal, healthy GI tract. Antibiotics can help prevent a bacterial infection. And for labs, in the text, it was noted you may see an elevated white blood cell count just because those white blood cells are trying to target any excessive inflammation or an infection of some kind. So you can see some elevated WBCs there. The nutrition therapy is really what's important, and I want to avoid any confusion with this. During diverticulitis, when we're currently having symptoms, we want the patient on a low fiber diet. They can include high protein there too. The high protein can help them heal up a bit. But the low fiber diet is there just to chill that GI tract out. We do not want to add fiber in here. Whenever I talk to a patient, I always told them, imagine you have a big cut on your arm and you took a bunch of rocks and you just threw it at that cut. How's that going to feel? Not well, right? So that's what you're doing when you eat fiber when you have diverticulitis. But diverticulosis, we actually want them on a high fiber diet. We want them to be consuming a good amount of fiber, giving themselves a nice healthy GI tract, keeping their bacteria nice and healthy too. So during diverticulosis, we can do the fiber. Diverticulitis, we do not want the fiber. So make sure you just know that differentiation there. All right, RD to B, you've sat through, you've grueled through each of those different GI disorders and diseases. Now I think it's time you apply them to some practice questions here. Let's dive in. Number one, a patient receiving tube feeding reports abdominal bloating after feedings that leads to vomiting, bloating, and fullness. Which of the following medications would be recommended for the patient's symptoms? A. Antikinetic agents. B. Prokinetic agents. C. Laxatives. D. Antacids. A patient receiving tube feeding reports abdominal bloating after feeding that leads to vomiting, bloating, and fullness. Which of the following medications would be recommended for the patient's symptoms? So I'm going to write A, B, C, and D on my whiteboard or scratch sheet of paper, and I'm going to use process of elimination to say what's a bad fit, what's a good fit. Starting with A. Antikinetic agents. Antikinetic is not something I'm totally familiar with, but antikinetic sounds like decreased movement. So this would be a medication that would decrease the movement in the stomach area. I don't think A is a good answer because we need things that increase the movement, because to me, it sounds like they have gastroparesis. It sounds like the bolus or the tube feed is just sitting in their stomach. So let's move it forward. I'm going to get rid of A. Antikinetic is not a good fit. B. Prokinetic agents. Prokinetic agents would be a good answer because prokinetic or promotility would help to move that stomach along. So I'm going to hold on to answer B. C. Laxatives. Hmm. I don't think a laxative is really indicated for this patient in their fullness. It seems like an odd one. I'm going to get that out of there. And D. Antacids. Well, antacids do target the stomach, and we are talking about the stomach here, I believe. But I don't think this is an issue of excessive acid. I think it's an issue of the food just not moving. I would get rid of D. This leaves me with my best answer as being prokinetic agents for a patient with vomiting, bloating, and fullness after their tube feedings. Hopefully, you did well on that one and easily use that process of elimination to get yourself there. Number two, a patient with peptic ulcer disease should consume a meal consisting of A. Low fat proteins, coffee, and spicy peppers. B. Fried foods, alcohol, and coffee. C. Low fat meats, fruits, and vegetables. Or D. Coffee, fruits, and vegetables. A patient with peptic ulcer disease should consume a meal consisting of, let's see our answers. For A, low protein options. Okay, so for A, it says low fat proteins. Okay, that sounds okay to me. Coffee and spicy peppers. Hmm. Well, if I have an ulcer in my stomach, I don't know, coffee and spicy peppers just doesn't seem like it's going to help it out. I would get rid of A because coffee and spicy peppers don't sound good, but the low fat proteins sound good. But I'm going to get rid of A there. B, fried foods, alcohol, and coffee. Well, what do you think, RD to B? Should I get rid of this one? I'm thinking yes. Alcohol, coffee, fried foods. Oof. Sounds like it's going to make that ulcer even worse. Get that one out of there. C, low fat meat, fruits, and vegetables. I think this answer is okay to do. It doesn't sound like it's going to exacerbate that ulcer. I would hold on to C. And then D, coffee, fruits, and vegetables. Well, I think the fruits and veggies are okay. The coffee, I'm not as sure on. So if I'm stuck between answer C and D, I'm going to go with C, low fat meat, fruits, and vegetables as my best meal for a patient with peptic ulcer disease. Number three, a patient currently admitted for diverticulitis would be recommended to consume any of the following meals except A. Whole grain sandwich with raw baby carrots. B. White rice with broiled chicken. C. Pasta with cream sauce. Or D. Canned peaches with cottage cheese. A patient currently admitted for diverticulitis would be recommended to consume any of the following meals except for A. Whole grain sandwich with raw baby carrots. Well, I feel like A has a lot of fiber in it, whether it's from the sandwich and the baby carrots. And I don't think I want to do a high fiber for diverticulitis. So I'm going to hold on to A. I think that might be a good answer there. B, white rice with broiled chicken. This seems like this would go okay with someone with diverticulitis. White rice does not have that much fiber in it. Broiled chicken's got no fiber, I'm pretty sure. So I think B would be an okay thing for diverticulitis, and thus I'm getting rid of it. C, pasta with cream sauce. It didn't say what type of pasta. I'm going to guess that they just mean like refined pasta there. I think that C would be fine for a patient with diverticulitis. I'm going to rule that one out. And D, canned peaches with cottage cheese. I think this one would be okay with someone for diverticulitis. The peaches we should watch out for, but think about the fact that they're canned, they're not fresh. They probably don't have as much fiber content because they're probably peeled. So I would say I could do that for diverticulitis, and I would get rid of D. This finally leaves A as my best answer. It's the highest fiber option. And for a patient with diverticulitis, we would not want them to consume answer A, which is a whole grain sandwich with some raw baby carrots. That wraps up today's lesson, students. I hope you watched, listened, learned, and enjoyed today's show. Remember that passing this exam is a journey. We all need assistance along the way. Do me a favor, hit the subscribe button wherever you like to watch or listen. Rate, review, comment. Let me know what you want to see in future lessons if you do. Join the RD Exam Ready YouTube page if you want to see some more free content. Check out RD Exam Ready Instagram. And remember, as always, Happy studying to you, RD to be.